Hey friends, Dr. Abdul El-Sayed here. I'm a doctor, epidemiologist, and former health director for the city of Detroit. When I ran for governor of Michigan, I ran on a Medicare For All style single-payer health system plan. It was called MichiCare. Now, one might ask, what is Medicare For All? And that's what I'm here to clear up. Medicare For All is a single-payer healthcare program that provides cradle-to-grave government-supported healthcare for every single American. Under the current proposals, it's free at the point of care, so it doesn't discriminate against low-income Americans. You don't have to worry about pesky things like deductibles, like premiums, like copays, and you don't have to worry about fighting with some corporate bureaucracy to get the services you already pay for. Now, in the coming months, you're going to hear a lot from Republicans and the corporations that support them, claims about Medicare For All that it's dangerous, it's going to destroy the insurance industry as we know it, it's politically impossible, it'll end human life. Just kidding, that's climate change. And you're not going to hear that from Republicans or corporations. For right now, let's get the facts straight. Here's the truth about Medicare For All. Claim 1, Medicare For All is way too expensive. False. In fact, according to a study funded not by progressive think tanks, but by the libertarian Koch brothers, Medicare For All will actually save Americans money. Part of the reason why is because we pay way too much in overheads. And when I say overheads, I mean money made by corporate CEOs to the tune of tens of millions of dollars. That goes away under Medicare For All. But one of the parts that people don't really appreciate is that right now, we've got a localized monopoly in healthcare. We allow hospitals and providers and insurers who are all focused on their profit to come together, go behind a closed door, and negotiate the costs of our care. That's why we pay more per capita than any other country in the world for healthcare. What Medicare For All does is establish a government monopsony. Now, you've probably heard the word monopoly. That's when you have one seller of a good. A monopsony is when you have one buyer of a good. And just like a monopsony can control the prices. And in this case, the government monopsony, Medicare, would bring those costs down for all of us. That means that we pay substantially less per capita in healthcare, we save dollars. But here's the other part. Right now, Americans are paying through the nose for prescription drugs that keep us alive. And one of the reasons why is because our government cannot negotiate the price of drugs. But under Medicare For All, the government would have that ability to say, we will pay this much and no more. That brings down the cost of very expensive prescription drugs, one of the highest priced line items in everyday budgets. Number 2, Medicare For All will mean healthcare rationing. In Canada, they have a single-payer health system. And single-payer means that in the end, everybody gets the care they need. One of the problems that we have in our current health system is that in fact we do ration care. It happens in 2 ways. Number 1, about 10% of Americans cannot afford health insurance. That means they're left out of the system entirely. We're rationing care because those folks are too poor to afford health insurance or don't get it through an employer. But number 2, even when you have employer-provided health insurance, you've got to negotiate with that big insurance company just to get the health care that you already paid for. That is rationing. I want to tell you a story about a woman named Arana Cunningham. She needed a radiation treatment that her doctors required for her cancer. She died shortly after because she didn't get it. That's rationing. A jury, it awarded the Cunningham family $25.5 million after they found that their insurer had behaved recklessly in denying her coverage. Let me tell you something else that's reckless. A CEO of an insurance company making $19 million a year to keep us from getting the care that we need, the care that we deserve. But right now, too few people have access to that. We are rationing healthcare based on who can afford it. We have to stand up, and under Medicare For All, no matter who you are, if you need care, you're going to get the care that you need. Fake fact number 3. The quality of your healthcare will decline because there is no market competition. Not true at all. Again, we have to remember that the healthcare system is 2 groups, payers and providers. Medicare For All doesn't do anything on the provider side. In fact, the doctor, hospital, even pharmaceutical company that you rely on for your services, they stay private. But what changes is you don't have a corporate insurance system telling you what you can and cannot have. And the fact of the matter is, insurance has never increased the innovation of our health system. All it has done is say who can and can't get care. We can do a lot better. And let's not forget, those medications that we rely on every day, so many of them started out as government-funded research projects funded by the likes of the National Institutes of Health, that of course gets its money from you and I, the American taxpayer. Government actually has increased the innovation of our health system, not decreased it. Fake fact number 4. It's politically impossible. That's just not true. It's in fact a political necessity. Americans are dying unnecessarily because they're not getting the care that they need. And you know what? The American public knows it. That's why 70% of Americans in poll after poll favor Medicare for All. Not just Democrats, but a majority of Republicans too. The fact of the matter is that if we are willing to come together and do what politics is supposed to do, create a government that solves our problems collectively, Medicare for All is the obvious answer. Fake fact number 5. They tell us that there are better programs than Medicare for All. That's just not true. The fact of the matter is that every one of those other programs, they protect the private insurance industry. And as we talked about, that private insurance industry, it introduces a lot of inefficiency into our healthcare system. It keeps the cost of care expensive, and it keeps our system segmented. They'll also tell us that we can get to universal coverage without Medicare for All. But here's the thing. Even if we were to compromise and pass a public option healthcare plan, in reality, most of these people with employer-sponsored health insurance, they won't be able to keep their private insurance under a public option system because at the end of the day, the public option is cheaper. So employers will force their employees to enroll in it. Don't get me wrong. It's great that 70% of Americans who get healthcare coverage through their job say that they're happy with it. But my question is, what proportion of them are actually happy with their jobs? And what proportion will always have that same job? What proportion are stuck in that job because they're afraid of losing their healthcare? One of the important things to remember about Medicare for All is that it would unlock huge amounts of our human capital. Too many folks are stuck in the jobs that they have because it provides them and their families good healthcare. We've got an opportunity to empower them to go off and start those small businesses, those projects that they are passionate about, build out their economic potential. We've got to keep fighting for the ACA and keep fighting for Medicaid expansion, but it's not enough. These segmented programs are not meeting the needs of all Americans. We could do so much better. It's a simple solution. It's called Medicare for All. Fake fact number 6, that everybody in healthcare is going to lose their job. That's just not the case. At the end of the day, it is really important for us to manage a just transition. That as we move from a private health insurance system to a public health insurance system, that everybody gets access to a good quality job that'll be created. But beyond that, let's remember that Medicare for All would instantaneously provide access to health insurance for 10% of Americans who currently don't have it. That's going to create a lot of jobs. So we've heard some of the arguments they're going to use against Medicare for All. But let me tell you the one argument that matters most. It's the right thing to do. That moral truth that we as a society, the richest, most powerful country in the world, can and should and must provide basic health care to our people, that's the real argument that matters here. Those folks who claim that Medicare for All is too expensive, it'll lead to rationing or a decline in the quality of care, it's politically or practically impossible, they're not just not being realistic, they're missing the moral clarity of this moment. We've got an opportunity to do so much better, but to get that done, it's going to take a grassroots movement of people agitating for the future that we want. A future where anyone and everyone in this country knows that they'll get the healthcare that they need when they need it. In order to get there, we, the people, are going to have to stand up. We're going to have to decide that our future, our children's futures, are worth it. And that however challenging it's going to be, however strong we're going to have to stand up against the money folks who are paying their millions to buy off our politicians, that it's worth doing. And that every time they come back with their arguments, we're willing to come back with the truth, and more importantly, with moral force. We've got that opportunity right now. Let's go get it.